Hi, dear. Welcome back to the Wellness Coach. This is your trusted space for all things fertility, pregnancy, and wellness. Today, we're diving into week 5 of pregnancy, and this is a big one. Why? Because this is the week when your baby's tiny heart begins to beat, and many women start experiencing those telltale early pregnancy symptoms. So let's break down everything that's happening inside your body, how your baby is developing, what symptoms to expect, and how to care for yourself during this important week. What's happening in week 5? By week 5, your pregnancy is officially 3 weeks post-conception, and your body is now producing a significant amount of HCG, the pregnancy hormone. HCG tells your body to keep producing progesterone and estrogen, which are essential to supporting the uterine lining and maintaining the pregnancy. At this point, many women already have a positive pregnancy test and are beginning to feel the effects of hormonal changes. How big is baby at week 5? Your baby, still called an embryo, is about the size of an apple seed, around 1.5 to 2 millimeters long. It may be tiny, but some major developments are already underway. The embryo now has a beating heart, which may be seen on an ultrasound this week or next. Beginning formation of the brain and spinal cord, developing blood vessels and circulatory system, a simple neural tube which will become the brain, spinal cord, and backbone. By the end of this week, that tiny heart is beating at around 100 to 160 beats per minute, faster than yours. What's happening in your body? Week 5 is when many women begin to feel real pregnancy symptoms. Hormone levels are rising rapidly, and your body is adjusting to support the life growing inside you. Here are some common symptoms you may experience: fatigue, breast tenderness, nausea, food aversions or cravings, frequent urination, mood swings, mild cramping or spotting. Should you get a blood test? If you haven't already, week 5 is a good time to get your first prenatal blood work done. Your doctor may check HCG levels, progesterone levels, thyroid function, blood type and Rh factor, immunity to certain infections like rubella or varicella. First prenatal appointment. Most first prenatal visits are scheduled between week 8 and week 10, but if you have a history of fertility issues or early pregnancy loss, your provider may want to see you sooner. Your first appointment usually includes blood pressure check, urine sample, blood tests, review of medical history, possibly a transvaginal ultrasound. At week 5, an early ultrasound may show the gestational sac and yolk sac, but not always the embryo yet. Seeing the heartbeat typically happens in week 6 or 7. What to eat in week 5? Now that you know you're pregnant, nutrition becomes even more important. Here are some key tips. Keep taking your prenatal vitamin with folic acid daily. Eat small, frequent meals to help with nausea. Include iron-rich foods like spinach, beans, lentils, and fortified cereals. Eat healthy fats like avocado, nuts, seeds, and olive oil. Include complex carbs and protein in every meal to help stabilize blood sugar. Stay hydrated. Aim for 8+ glasses of water daily. Foods to avoid: raw or undercooked meat, fish, or eggs. High mercury fish, shark, swordfish, king mackerel, unpasteurized dairy, alcohol and smoking, emotional health and mindset. Week 5 is exciting, but it can also feel overwhelming. You might be navigating all sorts of emotions: joy, fear, anxiety, disbelief. All of it is normal. A few things you can do. Practice gentle mindfulness or breathing techniques. Start a pregnancy journal to track your thoughts and symptoms. Set boundaries with stress. Protect your energy. Talk to your partner or a trusted friend, and don't hesitate to ask for support if you're feeling emotionally off balance. Safe movement in early pregnancy. As long as you've been cleared by your doctor, gentle exercise can be incredibly beneficial in early pregnancy. Consider prenatal yoga, walking, swimming, light strength training. Things to avoid: high-impact workouts that involve jumping or sudden movements, lying flat on your back for extended periods, contact sports or activities with a high risk of falling. Always listen to your body. Rest when you need to. Real talk. What you're feeling is valid. Pregnancy in week 5 is full of changes, physically, emotionally, and hormonally. Whether you're full of joy or feeling uncertain, it's all part of the process. Remember, you are growing a whole human. That's amazing. You don't have to feel happy 24/7. Just be kind to yourself. You're doing better than you think. Coming up. Next. In week 6, we'll dive into even more rapid growth. Babies' facial features begin forming and symptoms can kick into high gear. Be sure to like this video, subscribe, and tap the bell to get notified every time a new week goes live. Thank you for watching, and I'll see you in week 6.